You're 3 weeks in, the injection is working, you know it is. But somehow, you are still getting hungry, not just a little. Actually hungry. You've done everything right, and the scale still isn't moving the way it should. You start wondering if you're doing something wrong, or if the drug is. That does not mean the drug is failing. Here is what's actually happening. Most people in that situation do one of two things. They eat less, or they wonder if the medication is broken. Neither one addresses what is actually going on. I'm Dr. Kim. If you're still hungry on Ozempic or Zepbound, it usually comes down to three things. Each has a different cause and a different fix. Most people assume it means the drug isn't working. That assumption is often wrong, and acting on it usually makes things worse, not better. The actual problem is usually something the drug is doing, not something you are doing. Most people spend weeks eating less and tracking more before they figure that out. This is not medical advice. Consult your doctor. The first situation is end-of-dose hunger, and this one surprises people the most. Semaglutide, the active ingredient in Ozempic and Wegovy, has a half-life of about 7 days, meaning the drug level in your body drops by roughly half within a week. It peaks a day or two after injection, then gradually declines. By day 5, 6, or 7, some people notice something. Hunger starts creeping back. The medication is still there, but its effect on appetite is at its lowest point of the weekly cycle right before the next dose is due. That's not failure. That's just how a weekly injection behaves. Tirzepatide, Mounjaro, and Zepbound moves through the body a little faster. For some people, that means hunger starts returning earlier in the week, sometimes by day 4. The pattern feels the same. A good stretch early in the week, then a rougher stretch before the next shot. If your hunger follows that weekly rhythm, better early and worse toward the end, this is probably timing, not failure. One practical detail that gets overlooked. Injection day consistency matters more than most people think. Taking the shot on different days each week creates an uneven drug level cycle. Some weeks the lowest point hits earlier, some weeks later. If the day keeps shifting, the hunger pattern becomes harder to predict. Picking a fixed day and staying with it gives the drug a consistent rhythm to work with. There is also something that makes this window worse. When drug levels are at their lowest, sleep and stress hit harder than usual. Poor sleep and high stress both raise the signals that drive hunger, through different pathways, but in the same direction. A rough week landing at that lowest point can feel dramatically worse than either factor alone. It is worth knowing that pattern exists before assuming the medication stopped working. Here is what most people get wrong at this point. When end-of-dose hunger hits, the instinct is to eat less and push through. But restriction during that window often backfires. The body is already running on lower appetite suppression, and adding aggressive calorie cuts on top of that can increase stress hormones in some people, which then drives hunger even harder. The harder you fight it, the stronger it comes back. That's reason 1. 2 more to go. The second pattern is simpler. The dose may just be too low for where you are right now. These medications are started at a low dose and increased gradually over months, primarily to manage stomach side effects like nausea and upset stomach, but the trade-off is that lower doses often provide less appetite suppression. The full effect builds over several weeks as the dose goes up and the drug builds up in your system. So if you are still in the early part of that process, hunger right now is not a sign that the drug doesn't work for you. It may simply mean you haven't reached the dose where it works best for your body yet. The same logic applies if you're staying at a lower dose because higher doses cause side effects you can't manage. That is a reasonable decision. But it means some ongoing hunger should be expected, and that is not failure. It is a dose question, not a drug failure. And there is a third situation that changes the entire frame, but most people never think about it this way. There are 2 kinds of hunger. One is real, your body genuinely signaling it needs fuel. The other is the urge to eat that isn't really about hunger at all. The craving that shows up when you're bored, stressed, or just because food sounds good, even though your body doesn't actually need it. That second kind even has a name: food noise, the background mental chatter about food that runs independently of whether your stomach needs anything. These medications are genuinely good at quieting it. Many patients describe a noticeable drop in that constant pull toward food within weeks of starting. But food noise is not the same as real hunger. When people say they're still hungry on these medications, they sometimes mean the noise has reduced but not disappeared. They're comparing where they are to the silence they expected, and that gap feels like something went wrong. Here is the uncomfortable truth. Most people start these medications expecting hunger to disappear. It doesn't. These medications were never designed to eliminate hunger entirely. The goal is meaningful reduction, not silence. Some residual hunger is normal and expected. A body with no hunger signal at all is not functioning the way it should. So how do you tell the difference? End of dose hunger follows a weekly pattern. It gets worse as injection day approaches and improves within a day or two of the next shot. If you can predict when it comes, that is a strong clue. Dose-related hunger is more constant, especially earlier on. It tends to improve gradually as the dose goes up over time. If things are slowly getting better week over week, that is the sign. Food noise is situation-specific, tied to stress, boredom, habit, or certain environments. It feels more like a craving than an emptiness. If the hunger shows up in specific situations but not others, that is the pattern to watch. And real hunger feels physical, an actual emptiness, not a pull toward something specific. For end-of-dose hunger, plan ahead for the back half of your injection week. Prioritize protein, fiber, and volume. Choose foods that stay with you. The medication is giving you less support during that window, so your food choices need to do more of the work. For dose-related hunger, the answer is usually time and a conversation with your prescriber about whether the current dose is the right one. For food noise, the drug helps but cannot do everything. Habits, environment, stress, sleep, these all feed into the hunger signal on their own. They reduce the noise, they don't soundproof the room entirely. Here is the bottom line. Still hungry does not mean the drug failed, it means you need the right diagnosis first. On Ozempic or Zepbound, that usually comes down to one of three things: end of dose hunger near injection day, a dose that hasn't reached full effect yet, or hunger that was never fully physical to begin with. Identify which one fits, and the next step becomes clear. The drug quiets hunger, it doesn't eliminate it. Medicine simplified, that's what this channel does. If you want more, hit subscribe. This is not medical advice, consult your doctor.